Hi, my name is Miri Berger. I'm the CEO and co-founder of a company named 6 Degrees. We're in the field of rehabilitation, and our passion and purpose is to revolutionize rehabilitation and reduction of pain while bridging the gap between the patient, the physical therapist, and doing it in a way that's fun and educational using AI and gamification. So, talking a little bit about the problem that we're addressing, there are 2.4 billion people around the world in need of rehabilitation due to musculoskeletal issues. And in the US specifically, there's a shortage of 17% of physical therapists or access to physical therapists. And if we're talking a little bit about the field that we're dealing with, which is reduction of pain and rehabilitation, and we're talking about amputations or stroke rehabilitation. So there's an amputation every 3.5 minutes, one amputation every 3.5 minutes, and a stroke every 30 seconds. So all of these people will need access to physical therapists, preferably one-on-one. They'll want personalized care. They'll want to see themselves getting better, and the hospitals or the centers will want to give this care and have the access, efficiently to as many patients as possible. But obviously, time and human interaction has its limitations, and that's where we come in. Talking a little bit about the current standard of care, and if I'm focusing on the field of reduction of phantom pain due to amputation, somebody who's just undergone an amputation, if he's one of the 80% that has undergone the amputation, he will feel phantom pain. He'll automatically get recommended the standard of care, which is mirror therapy, which is a one-on-one 40-minute session for a minimum of 10 sessions uh, to kind of convince the brain that the limb is there and giving feedback in order to reduce the pain. That's been the standard of care since the 80s, and the revolution has come in the US for that treatment. The alternative to mirror therapy would be pain medication. And mirror therapy is, of course, only available if you can project a limb in front of a mirror, meaning double amputations don't fall into that category. You would have to have the second limb in order to undergo the treatment. Um, and in terms of the treatment itself, it's one-on-one 40 minutes, which is high human touch or interaction, but it's also boring, which brings it to statistically, people will stop doing it by the fourth session out of 10. And as I said, the alternative is pain medication. And so what we offer is first technology that allows you to perform a treatment with this type of feedback from the actual limb, meaning you could have a double amputation or a single amputation or more. And so it gives that access to recovery to a bigger population in need. Secondly, we're doing it through a gaming experience. So people will put on our devices on their lower limb or residual limb or full limb, put on VR, and see a soccer game or a music game with a crowd cheering. And basically, when they move their limb, they'll see a full leg all the way down to the tip of their toes or the heel of their leg kicking a soccer ball. When they hit that virtual ball, they'll feel haptic feedback. They'll see it happen, hear it happen. It'll bring a higher signal to the brain, the feedback, effectively reducing the pain. And with that comes many times less opioids, less pain medication, and of course, higher function. Because talking to many patients, pain is like, it has been described as somebody just tapping you on the shoulder all day saying, "Hey, I'm here, notice me." And then once you free your mind to not notice that tap on the shoulder, um, you have um, you have a space to do what you want to do, fully concentrated, and that's kind of the initial experience that we want to bring. On the technology aspect, we're differentiated by the fact that we're personalized, meaning we learn about each user in a very quick 5-minute onboarding. We learn about their ability, and we know how to match that ability in real time to a full result. The second way that we're differentiated from the market is I think is a little bit connected to our outlook. We really believe in the carrot and stick approach, where there are multiple accountable people in the process. So having the report go both to the patient as well as the physical therapist, and being an extension, like an arm extension or a tool extension to the physical therapist for the patient at home, uh, but not replacing them in any way, is how we feel we are differentiated than other solutions that are offered today. And the third way we're differentiated is that we can really show a reduction of pain. That's a differentiation from other solutions in the market which aid the physical therapy or track the motion that can't really show reduction of pain or substitution to opioids. I founded the company with my now husband, my partner, who's an injured veteran. He actually got injured in the Army as a paratrooper, a severe nerve injury. And it's a kind of injury which is lifetime maintenance. And so it's like every aspect of your life. And all you want to do as someone in recovery is gain these little bites of independence. And so it was really present with us. And as he was running the innovation lab at NYU, starting tech companies, and I was doing industrial design, we came across other people in need and kind of came up with initially a solution for one person, and it grew from there. We knew that we needed to utilize learning algorithms, machine learning, in order to specify or kind of match or translate a person's ability of motion or movement into what a digital device reads that they're doing, and kind of keep um, filling the gap or seeing the delta or seeing the change. And that's how we really got into it. So it's, math, biology, life, kind of everything together. So we completed our first clinical trial, basically comparing the use of this technology as a tool for reduction of pain in comparison to mirror therapy. So we did an as good as study with Sheba Hospital. It's one of the 10 leading hospitals in the world, the biggest one in the Middle East. And basically, what we saw there is that it effectively reduces pain and allows physical therapists to see more patients effectively and engage in an engaging manner. Meaning, someone would finish the treatment and say, "This is the most fun I've had in a while." Which, again, this is in a hospital setting. This is treatment. So it was, you know, we knew it was different at that point. So that study was published or completed in March of 2023, published in October, and that's when we started working with the VA in the United States. And they're currently applying this not only for in-clinic use with veterans, but also for remote care, for remote rehabilitation, and past the patient benefits, looking at the clinic benefits of, how can we stay engaged remotely? How can we pick up the phone and see if somebody didn't do something, through their medical file in a HIPAA compliant way and everything? Pick up the phone and go, well, is something wrong? Should we change it? What you're doing? Should we bring you in? And so, having that back, the two clinical studies with two really big locations or centers has really been, kind of an accelerant for the company in the past few months. 6 Degrees is really growing. It's seeking further clinical validation in fields like stroke recovery, trauma, nerve injuries, and others. And we're at a stage where we welcome design partnerships, integrations with existing processes. And I really would encourage people to reach out and see if there's a way that we can work together.